We often see TV ads that promise to reduce inflammation in our body, but those may not help enough if we are eating things that make the problem worse. So, here to talk about an anti-inflammatory diet is Dr. Armand Shyesta, the owner of the Fit for Life Nutrition and Weight Loss Clinic in Dublin. Welcome.
Good morning.
Good morning. Happy to have you. Always a load of excellent information. How can inflammation of the body create even more health consequences for us?
Crystal, chronic inflammation is the worst condition for human body. If you look at the inflammation, literally feeding every disease in our body, arthritis, rheumatoid arthritis, osteoarthritis, autoimmune disease, lupus, MS, most cardiovascular disease is surprising. Cardiovascular disease is actually inflammatory disease. Alzheimer's disease, now research inflammation. It got part of the brain called hippocampus, cause inflammation in that area in the brain cells and actually produce a sticky protein called amyloid plaques, actually kills the brain cell, actually shrinks the volume of hippocampus. Inflammation connected with a lot of cancers are inflammatory disease. Most of the pulmonary disease, such as asthma, is inflammatory disease. Nerve damage is inflammatory disease, type 2 diabetes. So it's very critical that we absolutely prevent chronic inflammation of our body. The question is, what causes inflammation of our body?
Right.
Number one contributing factor is belly fat. This is interesting. Belly fat produces multiple inflammatory markers from CRP, interleukin, tumor necrotic factor, adipsin. These inflammatory markers get your blood circulation and damages from head to toe. That's why even 10 to 15% of weight loss in most cases beautifully shut down these inflammatory markers and significantly reduce the inflammation.
What's tough is that that's the hardest fat to lose sometimes.
Actually, Crystal, if you pay attention to nutrition lifestyle, it's beautifully responds to the to a program. In most cases, when they lose even 10%, research shows that they lose more than 60%. If you do the right way, proper nutrition, not starvation, and proper exercise, 60% that fat comes from the visceral belly fat, which is that exactly we want to lose. Because fat in the thighs and hips are protective. Fat in the belly area is the dangerous one. That's why we always mention, measure your waist. If it is more than half of your height, that means too much belly fat. Correct. Also, leaky gut syndrome. This is inflammation in the gut because of the abnormal gut bacteria. Imbalance of gut bacteria causes severe inflammation in the body. So by changing nutrition, we can correct the leaky gut syndrome and reduce the inflammation. Food that is high in fat and sugar and salt, again, major inflammatory markers, reduces and causes severe inflammation. It's interesting. The person eats fast food place. Before they come back to their home, they already have activated the inflammatory gene. Body is pouring multiple inflammatory markers in their body, damaging every organ they have. This is very interesting research, Kirsten. Now research shows through the nutrition, we can change the function of the gene. We can actually silence the bad gene. We can activate the good gene. That's why the research shows, look over here on the left side, healthy fat, saturated, unhealthy fat, those reds means those genes are expressed and they're producing all these inflammatory markers. By changing nutrition and from bad fat to good fat, you can see a lot of these genes are silenced. So we have the power through nutrition, silence these inflammatory genes and make a huge difference. That's why we personalize the nutrition. Everybody's different. That's why we have to design a program that actually works at the genetic level and silence these genes. That's why putting together all these inflammatory foods, Mother Nature has given a beautiful medicine to us. Amazing, works without side effect because most of anti-inflammatory medication have multiple side effects. This one doesn't have. Going back, antioxidant. These antioxidants actually shut down those inflammatory genes. So you instead of producing these harmful chemicals, you're silencing those.
Now, if we want to get started on this personalized diet plan, can you help us do that?
Absolutely. That's where we sit down and to see what kind of inflammation they have, what organs are affected, and we absolutely tailor the nutrition, that we go at the genetic level. That's exciting part of it. Adding healthy fat is absolutely critical part of silencing that. And also herbs, spices. Thousands of years Indians would use that as a medicine, and incredible. Food can change your gene function. We cannot change the sequence of your gene, but we can change the function of your gene and silence that inflammation. When it comes to inflammation, food is absolutely the medicine.
Wonderful. Well, you can go to Dr. Shyesta's office in Dublin and actually get a free consultation. Is that right?
Correct. Everybody gets free initial consultation. We look at all their nutrition, their blood work, their medical history, and everything tailored absolutely on a personal level. That's how it works because nobody is the same person.
Fantastic. Thank you so much, Dr.
Thank you for having me on your show.
For more information, drfitforlife.com.